CEO of Vail Health. Just want to welcome everybody. We're going to give it another 30 seconds to let others who are signing in get signed in, and then we'll get started. Thank you. We'll start momentarily. Okay, good afternoon again. My name is Will Cook. I'm President and CEO of Vail Health, and I'm very excited to welcome you all today. I know there's some folks still joining. We'll go ahead and get started so we can leave as much time as possible for any questions that you may have. But this is our annual State of Vail Health for 2025, and we're very excited to talk to you about some of our accomplishments in 2024 and some of the exciting things that lie ahead for us in 2025. So let's go ahead and get started. If you wouldn't mind, let's go to that next slide. I want to start by taking a moment of silence to recognize two individuals who have been so influential, not only in our valley, but in our state and really across the world. That's Jay Precourt and George Wiegers. Please, if you don't mind, let's take a moment of silence to remember all that they've done to improve the lives of others. Thank you. And many thanks to Jay and George and to their families for all the support that they've provided to us over the years. Let's go to the next slide, please. We like to start all of our meetings with our mission because it truly is who we are. It's why we're here, and our vision because it talks about what we aspire to be. So our mission is to elevate health across the mountain communities we serve. And our vision is to be the leading mountain healthcare system, attracting the best talent to advance quality health for everyone in our communities. And I think it's always important to keep that in mind as we talk about what we've done and what we're planning to do. Next slide, please. We use that mission, vision, and values as our purpose, and it really informs our pillars. I know that you've seen this before, but I don't think we can emphasize it enough. Those pillars are affordability, accessibility, population health, and sustainability. And that helps inform our priorities. And for fiscal year 2025, you can see that that's talent development, increasing revenue and reducing expenses as all hospitals are now facing financial challenges, really continuing to focus on our orthopedic partnerships, looking at our infrastructure strategy and optimization, really executing on and further enhancing existing and developing new regional partnerships, whether or not that's with other independent health systems or larger front range health systems, insurance companies, our government partners, you name it. The key is collaboration. And of course, opening our new Precourt Healing Center, which I'm going to talk to you about here a little bit later in the presentation. But we really couldn't do any of these things if we don't have focus on our strategic enablers, which most of all is about people and culture. It's about quality and process, innovation and technology, making sure we have the right corporate and governance structure in place to enable us to achieve our goals, thinking about capital assets and cash liquidity, and most importantly, thinking about strategic partnerships and philanthropy. It's really so essential to us as we move towards our new goals. Next slide, please. So about Vail Health System, some of you on the call know about Vail Health, some of you may not. It's actually changed pretty significantly in the 6 years that I've been here. We are a proud independent community healthcare system. We're a nonprofit organization run by a board of volunteers. We have an A- bond rating. I'm really proud of the fact that we're only one of 429 hospitals in the US that has both a CMS, which is Medicare, 5-star rating for quality, and a Leapfrog A grade for quality and safety. That doesn't happen without really incredible providers, physicians, nurse assistants, et cetera, and a clinical staff that supports them. So it's a really important thing for us. We're very, very proud of that. We're also very proud of our new inpatient behavioral health hospital that you heard me refer to previously as the Precourt Healing Center. I'll be talking a little bit later about that, but that's going to open in May. We've committed over $200 million to inpatient, to all things behavioral health, pardon me. And that's not just Vail Health that committed that money. We've also raised a lot of money. We've received unbelievable help from our elected officials, from our very generous philanthropic community. But truly, we've started to move the needle now on how we address the behavioral health crisis that's plagued our valley and our state and really our nation. I'm also very proud to say that we are on the pathway to excellence. That's an American Nurses Credentialing Center designation that speaks to how our nurses have a say in governance, have a say in how they practice, and are involved in decision making. And again, I think it's a reflection of the culture we've worked so hard to build here. And of course, our partnership with the Stedman Clinic, the things that we do with Velsom and orthopedics and neurosurgery, the focus on being medical destination, mountain resort, taking care of Olympians, professional athletes, weekend warriors, and really even our local population as well. It really truly is a privilege to have that level of orthopedic services here in our valley. Next slide, please. So again, some of you may know this, some of you may not, but we thought it would be helpful to show a map that depicts our locations. We're not just in the center of this map, which is the Eagle River Valley, where you think of Vail and Beaver Creek and Eagle and Gypsum. We are also in Summit County. More specifically, we have a medical center in Dillon. We have locations in Frisco and Breckenridge. And again, we partner with our orthopedic partners there in Stedman Clinic and Velsom Orthopedics and Neurosurgery. But we also have Colorado Mountain Medical there, primary care, specialty care, urgent care. We also have the Shaw Cancer Center with a presence there. Really, really excited about these new locations in Summit County and over in the Roaring Fork Valley in Basalt, where we have a joint venture arrangement with the Stedman Clinic and with Aspen Valley Hospital. Really growing, expanding healthcare system that's really in our mountain communities, and I'm very proud of all of our locations and all that we've been able to accomplish through partnership. Next slide, please. So our 2024 accomplishments. Now, a lot happens each year and many things are going on, but we tried to pull out the things that we felt were most important. And I'm most proud of our employee engagement index of 89 with a 90% survey participation rate. You may be saying, well, what does that mean? Well, first and foremost, I think at any point in your life, you filled out a survey of some type, whether or not it's a satisfaction survey or feedback on how you feel when you work at an organization. To have 90% of our staff complete this survey really speaks to how engaged they are. And an index score of 89 puts us in the top quartile in the country. And they say all the time that, culture eats strategy for breakfast. And you saw in our previous framework that people and culture are really the most important enabler. And I, again, can't emphasize enough how great our providers and our staff are and how hard we work to not only take care of patients and their family members, but of one another. And I think this is really the differentiating factor for Vail Health. So proud of the teams there. And again, that leads us into our ability to really focus on quality and safety, the CMS 5-star rating, the Leapfrog A. We also completed a very unique public-private partnership on building out housing for our employees. We did that with Brett Grand Vacations. Really grateful to Graham and his team and to Craig Cohn who helped make that happen, but also to our elected officials, also to our donors, so many people who've helped us build out 90 housing units in Edwards, Colorado. That was really important for us, especially as we were trying to open up our new inpatient behavioral health facility. So while housing still is a problem, we're all working collectively to try and solve for it. This is an example of a unique partnership that we think is moving things in the right direction. And then also another big accomplishment, again, I'm going to talk about in a minute, is finishing the construction of our Precourt Healing Center. It's a 28-bed inpatient behavioral health facility, 14 beds for adolescent patients, 14 for adult. And we can swing some of those beds need be, but the reality of it all is by having this inpatient facility now in our own valley, on the same campus with the Uyghurs outpatient clinics, which provides comprehensive outpatient services, and with the case management services, and with our local food bank there, and with so many services that serve this community. This is a game changer for us. We now have behavioral health therapists embedded in all 17 schools. We have them embedded in primary and specialty care. We're working very closely with Your Hope Center, the crisis response unit that's out there. We're working with law enforcement. We're working with EMS, so many other nonprofit organizations, Eagle County paramedics, you name it. It has been entirely a collaborative team sport, and we're so blessed to have comprehensive services that when someone gets sick or has a need, they no longer have to leave our valley. And this is something about which we all should be incredibly proud. I know we are. Next slide, please. This is our FY24 Elevate Award winners. For those of you who entered in a submission to nominate someone, I want to thank you. And for those who are wondering what is an Elevate award, I want to make sure you know about that. So we've asked patients when they've had a great experience at our organization to send in a letter talking about their experience, describing how it made a difference in their life. And we received literally hundreds of these. And it's so rewarding to read it. And it's so hard to pick one winner, but we do it on a quarterly basis. As an example, you can see on the screen here, and I'm sorry, it's a little small. Dr. Scott McCorvey is a physician in our emergency department. He's actually the leader of our emergency department, but also is an amazing physician. And he and the team there do a wonderful job taking care of patients day in and day out. That's not just our doctors, it's our advanced practice practitioners. It's also our nursing staff. It's the administrative staff. Couldn't be prouder of that emergency department. And I'm so grateful that he received a reward there. In addition to that, we had a physical therapist from Howard Head Sports Medicine receive an award, Ely Sabins, and so proud of her. And I wish you could read these letters. It's pretty remarkable. We had a registered nurse in our pre-op area of the hospital OR, which was incredibly rewarding and wonderful. And we'll be announcing our fourth quarter winner a little bit later this month. So stay tuned. And again, if you receive great care, if you think that someone's made a difference in your care or your experience, please take the time to share that with us, because we use this to provide good feedback to our employees so that we can condone that behavior and encourage it with others. So thank you so much for that. Let's go to the next slide, please. These are a listing of various accolades. Now, I won't go through every single one of them, but I do want to call out a few. So as an example, the Apex Accredited Facility Award is something that our Shaw Cancer Center received, in particular our radiation oncology area. There's only a handful of places in the state of Colorado that have this. And it speaks to the level of care, the quality of care, the equipment, the people, the processes, all the things that go into providing care in that Shaw Cancer Center, in particular in radiation therapy. This is a big deal to have this accreditation. And I just want to thank Dr. Patty Hardenberg, really the entire team there. We're also excited. We've recruited another radiation oncologist to join Dr. Hardenberg. I think it's Dr. Ben Hopkins, and I believe he may be listening in on this today. If so, we look forward to welcoming you to the Valley. I know it's not until the summer of 2026, but time flies, and we're excited to be able to continue to offer these world-class services here close to home, like behavioral health, like orthopedics. Couldn't be prouder of the Shaw Cancer Center. So thank you for all who are involved there. Also just want to take a moment to call out the fact that we frequently are receiving Press Ganey, who does patient satisfaction surveys, awards. And again, our emergency department continuously gets awards for having very high patient satisfaction. And that's not limited to our emergency department. It happens on our nursing units. It happens in our surgery areas. It happens in our physical therapy areas. It happens in our doctor's offices. And again, I think it's a reflection of a group of people who are called by a mission that means something to them, who are focused on taking care of each other and taking care of our patients. And really, at the end of the day, that's what we're here to do. So while we appreciate the accolades, it really comes down to how much we really value taking care of people. So thank you for that and for all who've been involved. Next slide, please. Our community impact report. So if you think about our mission and vision and values that really inform our pillars, I think of our pillars of affordability, accessibility, population health, and sustainability as four legs to a table that really are there to serve our community. At the end of the day, we are a community nonprofit hospital here to serve this and other communities where we have presences. And I'll tell you, I'm really proud of this report, not just because of the work that went into it, but more importantly, because of the impact that it's having on everybody in our community. And we'll continue to have these reports come out. And I just want to encourage you, if you hear about a health needs assessment, because we do provide these health needs assessments in the community, please volunteer. Take the time if you're able. Come to one of our CHNA sessions, community health needs assessments, so we can hear from you. on where are things that we need to focus that we're not currently focused. What are we doing well that we need to make sure we continue to do? It really is important. This community collaboration, working with our elected officials, working with other nonprofits, local businesses, and community members. It's really, really important for us as we decide where do we want to next focus our attention. Next slide, please. So financial health of Colorado hospitals. There are about 100 hospitals in the state of Colorado, and 70 out of those 100 hospitals, or 70%, currently have unsustainable operating margins. And of the 100 hospitals, more than 50 are rural hospitals. Vail Health is actually a rural hospital, and 85% of those have unsustainable operating margins. And we're in the same boat. And I want to make sure you understand that this is happening in large part because expense growth continues to outpace revenue growth. In particular, expenses are 40% higher than they were before COVID, and that's a real challenge. Next slide, please. If you talk about the financial health of Vail Health, now, of course, we've spent decades making sure that we are financially strong, building up reserves so we could do things like invest $200 million in behavioral health, or $360 million in building out a brand new hospital that'll serve this valley for 50 years, or taking on Colorado Mountain Medical to help ensure their longevity. All of these things were done to help carry out our mission. But as we've now spent the money to do them, we now have to focus our attention on getting ourselves in better financial health. While we've had a 4% EBITDA, which is earnings before interest, tax, depreciation, and amortization, we'd really like to see that closer to 10%. We'd really like to see our days cash on hand, which are currently at 250 days, which basically means if we quit bringing any revenue in, how many days could we continue to operate? We'd like to see that number go up a little bit. Again, not only to ensure that we are safe and can remain independent, but also to enable us to continue to invest back in our community, to continue to invest back in our providers and our staff and carry out our mission. So we still have work to do in this space, but I want to make sure you understand that this is not unique to Vail Health. It's happening with most of the Coloradan hospitals. And I think that we're trending in the right direction. So we appreciate everyone's understanding and effort in that regard. If we can, I'd like to go to the next slide, please. All right. So one of the things that I think people know pretty well, but I really would be remiss if I didn't mention it here, is that at the end of the day, we are a surgery-centric health system. In fact, we are an orthopedic surgery-centric health system. And of course, that has a lot to do with the fact that we have these beautiful mountains in these communities that we serve. And unfortunately, people hurt themselves on it. But we're not just a mountain resort place where people come to visit, get hurt, and receive care. We're also medical destination. And we're medical destination because we have amazing orthopedic partners who are hyper-focused on research and innovation and cutting edge medicine. And that enables us to then attract people from all over the world. And that's a key component of what Vail Health is and how we pay for things like behavioral health. And I just want to make sure that everybody understands that we really depend on that key orthopedic surgery line. We really depend on everything that is medical destination. And I just want to make sure, again, we say thank you to the Stedman Clinic, to Vail Summit Orthopedics and Neurosurgery, to Howard Head Sports Medicine, to our anesthesia group, Anesthesia Partners Colorado. So many people are involved in this day in and day out. But to have access to this level of care truly is unique. I attended a hip symposium late last week that Dr. Mark Philippon put on. It was amazing. As I was sitting in the room, looking around at probably 50 of the greatest hip surgeons in the US, if not the world, and listening to some of the science and the advancements that they're all working on, it dawned on me, as Dan Drawball, the CEO of Stedman Clinic, was sharing with me, that about on average, an orthopedic surgeon will publish 12 papers in his or her career after training. If you took the 6,500 papers that had been produced by the people that were in that audience, the average was about 250 papers. And the Stedman Clinic is the most published orthopedic group in hip arthroscopy. And the relevance of that is it really is vital that we continue to focus on research. We continue to focus on innovation. And that's not limited to orthopedics. It's happening in other places as well. In fact, let's go to the next slide where I can tell you a little bit more about it. So the Stedman Philippon Research Institute, that's what SPRI stands for, is the research arm of the Stedman Clinic. That's where a lot of exciting research is happening. We have 6 NIH, National Institutes of Health grants, 2 Department of Defense grants. We also have a collaborative project being worked on between the Stedman Philippon Research Institute and the Shaw Cancer Center. If you think about fibrosis, it's a fancy name for scar tissue. Most people were thinking of it in terms of an orthopedic injury or some sort of scar tissue after surgery. But people also get fibrosis or scar tissue when they have radiation treatments, in particular breast cancer patients. And so really the scientists from SPRI and the scientists and the clinicians from Shaw put their heads together and said, what if we can take some of what you're doing to reduce scar tissue in orthopedic surgery and apply it in radiation-induced fibrosis? That is a game changer. And we've seen really positive early results. And while we're not a major academic medical center, we'll continue to partner with places like UC Health on clinical trials or University of Wisconsin in Madison on things related to behavioral health. We can and are really on the cutting edge of innovation in orthopedics, in cancer, and now soon to be behavioral health. And I really think it's important to realize that when you have something that happens to you, make sure you check, is this something that we can do here? And if not, I'm sure we have a relationship with someone who can. So just wanted to make sure you understand that research and innovation is really at the core of what we're doing, and it's happening everywhere. Howard Head Sports Medicine, the Vail Health Behavioral Health Innovation Center. I couldn't be prouder of some of the things that are happening there. We have a chilled study for how you heat people up and then cool them off. This has been going on for centuries as people have jumped into cold waters to really realize the benefits from a health perspective. We have the optimized study that will be starting a little bit later this spring. This is where we're taking psilocybin and using its scientifically proven effects on reducing depression and reducing PTSD. And no one will have actually, I should say it differently. Everyone will have the psilocybin. There will be a control group that actually has that plus something else as well. We're very excited to do this because we feel that the options that are out there, whether or not it's in orthopedics or oncology or behavioral health, we need to find new ways of treating disease and illness. And we think that there's much opportunity for that in behavioral health. Very excited for what the team is doing there and very grateful for all involved. Again, that's a collaboration with the University of Wisconsin in Madison. Let's go to the next slide if we can, please. Really just want to pause for a second before I talk to you about behavioral health and say that Chris Lindley, Dana Erpelding, Casey Wolfington, so many people. I'm sorry for even calling out names because I'll leave others out. They truly have been the energy, the driving force behind a lot of things that are happening in behavioral health. But it's not just them. It's also been our elected officials, other nonprofit organizations. It's been the school district, law enforcement, you name it. Everybody has leaned in, really since back in 2017 when there was the first marijuana tax initiative that was passed, to really figure out how can we come together and share precious resources to address what we believe is the true medical crisis of the century, which is behavioral health, not COVID. And sadly, we had one of the highest suicide rates in the country. Our state was rated close to the last in terms of behavioral health challenges. And we all came together and said, we have to create a movement. We've got to engage everybody to figure out how can we begin to address this problem. And that's when Eagle Valley Behavioral Health was created as a wholly owned subsidiary of Vail Health in 2019. And our mission was to lead community collaboration to transform the behavioral health system. And I think you're going to hear about ways in which we've done that. Let's go to the next slide. In 2020 to 2021, goodness, I think we all remember those years for COVID, but it actually was when we were starting to really get started with behavioral health. And thank goodness that we did, because I think COVID shined the light on the fact that there really was opportunity for us to take care of vulnerable populations. And so many people who were isolated and who weren't in school really began to struggle with behavioral health issues, especially our adolescent population. But this is when we launched our $100 million It Takes a Valley campaign. I want to thank the Vail Health Foundation, in particular, Mary Randall, who's our chair of that. She and Dan Godek co-chaired the It Takes a Valley campaign. So many of you volunteered time, your talent. So many people have given money. And so much of that money was not just to Vail Health, but to a lot of our nonprofit partners. And it really has enabled us to move the needle. So I can't thank enough our foundation. I can't thank enough Dan Pennington and his team and all who've been involved in all of this, because it really has been essential for us in figuring out ways to tackle behavioral health. And so we really got ourselves started. We tried to get out there and remove the stigma. We created Olivia's Fund so that access to money or access to insurance wouldn't be a barrier. We created a Mountain Strong Employee Assistance Program that now has, I think, over 12, 13,000 people involved. It gives people who are part of the program 6 free visits for behavioral health. And we've really seen this, from our perspective, move the needle in terms of people seeking out care for behavioral health the way we seek it out for mental health. Couldn't be prouder of it. Go to the next slide if you don't mind, please. In 2022, you'll see in a picture in a little bit, that parking lot is now comprised of our new Precourt Healing Center. But man, so much has happened in 2022, from becoming the first community mental health center in Colorado in over 40 years. Opening up access to state contracts, getting federal grants, breaking ground on the Precourt Healing Center. So many things were happening that were really foundational to us to have continued momentum even into 2023. Next slide, please. In 2023, we opened up the Uyghurs Mental Health Clinic. It is in Edwards. It's comprehensive outpatient. If you haven't seen it, I highly encourage that you do. We did so many other things, probably the most important of which was really got our commercial rates increased for behavioral health. We want to thank our payers who were willing to do that with us. This is really essential in terms of giving access to care for people who have commercial insurance. We launched our Vail Health Behavioral Health Innovation Center. Huge thank you to Mike and Mary Sue Shannon who helped endow that, which has enabled us to do things like the chilled study and like the psilocybin study I mentioned to you before. And again, just want to thank our elected officials, from the governor's office to down to our local municipal elected officials, our federal and state ones. They really helped us bring in state and federal grants that allowed us to continue to make meaningful movement in addressing the behavioral health crisis. Next slide, please. In 2024, we actually completed our construction. It was late 2024. We've gone through all the licensing processes now. We're getting close to finishing that. We're starting to hire staff and providers and making great progress. Believe it or not, we're averaging over 4,000 outpatient behavioral health visits each month at the Uyghurs Outpatient Center. Can you believe that? 4,000. Thinking of it differently, if we didn't have that service, think of how many people's needs would go unmet. So really just can't emphasize enough. Now we have a full continuum of behavioral health care services here locally so that people who have it can get what they need without leaving their support systems behind. So grateful and proud of the behavioral health team, but also want to call out the folks that work in Vail Health who don't work in behavioral health, who have supported this. Amanda Veit, who's our Chief Operating Officer and Chief Nursing Officer. She helps work with our orthopedic partners to keep that orthopedic train moving, if you know what I mean. She works with Michelle Goodman and Dr. Hardenberg to make sure that oncology is where it needs to be. So many people involved in this health system to ensure that we're thinking about everyone's needs and all pushing and pulling in the same direction. So I really want to thank not just our behavioral health team, but the entirety of our system. And now we're excited to open up in May of 2025. So if you go to the next slide, please, our new Precourt Healing Center. And again, I just have to pause for a second and thank Jay and Amanda Precourt for their vision, for their incredible generosity, for all that they did to help make this dream a reality. And many of you also contributed to make this a reality. You all should be proud of this. I've never seen a behavioral health hospital designed so well. It has the patient's interests in mind. It's thinking about not just mental and behavioral health, but physical health, making sure we're serving healthy food, making sure that we're building a sense of community, making sure people have privacy in their own rooms. Truly, to have an asset like this in Edwards, Colorado, it is amazing. There is a video tour available on our website and our YouTube channel if you'd like to see it for more details. But most importantly, I want you to know that this entire community came together and did this together so that people don't have to face their behavioral health challenges alone. You all should be as proud as we are. This is us leaning in to improve the lives of the people that live in our communities. And thank you for that. Next slide, please. So the key takeaways as I'm wrapping this up, collaboration is essential to addressing big problems and pursuing opportunities. And whether or not that's collaboration with our state or federal governments, collaboration with our local governments, collaboration with other nonprofits, collaboration within our organization, with other healthcare organizations, with their insurance companies, resources are way too limited and way too precious to not be always leaning in. The collective impact is the key. And we are more similar than we are different. And I think as long as we continue to put the right people around a problem, there's nothing we can't do. And so I again want to thank all of you who've been involved in those collaborative efforts and encourage those of you who have not to come join us. Figure out ways that we can tackle problems together. Figure out ways that we can elevate health across our mountain communities. We're going to have a continued focus on our long-term pathway to excellence and our financial sustainability. It's necessary, no margin, no mission. We're going to have hyper focus on research and innovation. Some people feel overwhelmed about what's happening in our external environment. We see it as opportunity. This is a chance for great organizations that are located in great communities to come together and figure out, how do we turn housing into an opportunity? How do we turn the behavioral health crisis into an opportunity? How do we do things differently? And I think together we can do anything we want. Again, very excited about our Precourt Healing Center opening in May of 2025. You should definitely try to check that out. And then lastly, a little teaser for you. We're going to be doing our next strategic retreat with our board in the summer of 2025. And I don't want to get too far out in front of my skis because we also want to consult with many of you in our community, with our frontline staff, with our providers, with our elected officials to make sure we're focusing on the right things. But I will tell you, we will be creating health span and healthy aging options because so much of our population is aging. And while our current healthcare model and system is great when you get sick, and it's great if you have an accident, I think we have opportunity in figuring out ways that we can live our healthier, better lives, how we can get upstream to problems, how we can try and postpone, if not entirely avoid, chronic disease. And so more to come in the space of health span and healthy aging options. But I want to make sure that you're aware that we will be having our strategic retreat this summer. We're excited to talk about all the opportunities that are out there. We will be thinking about other vulnerable populations, whether or not that's people without insurance or whether or not that's our older adult population. There's lots of challenges, but lots of opportunities. And together, we can do anything. So next slide. Just want to say thank you again for all that you've done, all that you continue to do to support Vail Health and our mission. And before we jump into the Q&A, I just want to remind people, do not use the chat function for that. Please use the Q&A button that is at the bottom of your toolbar. If you don't see it, you can wave your mouse over it and you should see it pop up. And with that, I'll turn it over. Sally, we're going to, I think, go to the Q&A session now.
Yes, let's go ahead and get started. Will, if you want to answer one of the questions that came through about emphasizing the value and importance of remaining independent.
Oh, yeah, that's a great question. We get it a lot. And, yes, we will and want to remain independent. I will say, though, that independence requires interdependence, meaning our best pathway to staying independent is to work with other independent healthcare systems and to work with front range, large integrated systems and to work with insurance companies and to work with the governments, whether or not it's federal, state, or local. Again, The key is collaboration, and how can we lean in and share precious resources? How can we lean in and figure out ways to tackle problems together, as opposed to the alternative? So, yes, we will remain independent. We look forward, though, to working with others to ensure that that happens.
And then this question, I think, is for Chris, to speak to our partnership with your Hope Center and what that support looks like.
Yeah, Allison, great question. Thank you. So, just to give a little background on the change of services and why Vail Health is taking on some of these services, specifically the crisis response, as well as working with the school district on the school-based.
Oops, I think we lost Chris. So we'll give him a second to pop back in on that one. And in the meantime, there is a question about what is being done to assure that there are adequate providers in the various specialties that continue to accept Medicare and Medicaid payments.
Yeah, this is a real challenge. And part of it is that we have 50,000 people that live in our valley, and maybe 35,000 in Summit, and another how many ever in the Roaring Fork Valley. And if you don't have enough population density, you don't have enough instances of something. And if you don't have enough instances of something, it's hard to maintain the competency to ensure quality. That matters most. And then secondly, if you do have enough for, say, one, then you have a problem of an N of one. So how do you deal with one provider in one specialty, and he or she not being able to take time off, he or she dealing with burnout? So really this is something that we're grappling with day in and day out, and trying to figure out, again, maybe we can pool precious resources in certain medical subspecialties like endocrinology or neurology, with some of our neighboring independents like Valley View, where we have patients and providers and family members permeating between the Roaring Fork Valley and the Eagle River Valley. There's a lot of things happening in that space right now. But we will be looking at ways that we can, through our accessibility pillar, continue to offer services, but we won't be able to offer all of them. And there may be times when you have to get some of those services in Glenwood, or some of those services in Summit County, or some of those services in Denver. We will first make sure we can offer a high quality service, and then we'll also make sure that it's sustainable, which is also one of our pillars. So we appreciate your patience as we work through this. Want to make sure you know that Vail Health takes all payers from a government perspective. We take Medicare, we take Medicaid, we take some of the veterans insurance, and we take most of the commercial insurance products as well. If you're having any difficulty getting care, please make sure you reach out to someone on our side, and we'll see if we can help you get what you need. Chris, are you back? Can we hear you okay now?
I am back. Sorry about that, Will, and others online. We lost internet temporarily here in Edwards. So just to get back to Allison's question, great question. The reason why Vail Health is working with the school district on the school-based clinicians, and why we've taken over the crisis services effective March, so in a few weeks, is all around sustainability of these services. They've been absolutely critical and key to everything we've done in the behavioral health space. They're actually two of our most proud, successful programs. But to maintain sustainability, we have to be able to capture revenue where there is revenue available. And specifically with the crisis response piece, the Medicaid, as of July, this last July, we have to turn in all of our encounters on a single electronic medical record. And so that's why we switched over and started having the Help Center clinicians start using our medical record. And it just made sense to move that program all the way over to where we have a much larger team. We now have 48 providers, outpatient clinicians on our team. And so those response capabilities will even be greater than they have in the past. But we're not changing anything related to the Hope Center response. Same phone number, same name, same response with our providers. Just being the oversight is moving to Vail Health Behavioral Health. And then the last little piece, as it relates to the school-based clinicians, we're working with the school district very closely, as well as the leadership of your Hope Center, to see how that best positions itself long-term to continue to provide the services that it has over the past. So hopefully that answers the question.
Thank you for that, Chris. Just one little supplementary comment. You know, as we all are facing the same challenges, whether or not that's retaining and recruiting staff because of the high cost of living in the mountain communities, or whether or not it's, inflation and all of the things that have really made it very difficult. One of the ways that Vail Health is trying to help our nonprofit partners is by serving as an anchor institution of sorts. How can we leverage our back office functions? How can we leverage some of the resources that we have to lean in? And again, whether or not that's raising money for the $100 million campaign, or sharing in our revenue cycle, or sharing in our IT or our electronic health record. So we're constantly trying to find ways together we can all be sustainable. And sometimes that's sharing in precious resources. So thank you, Chris, for that explanation. I agree with you. Your Hope Center has been really some of the secret sauce. And so we're so grateful to them.
This next question is about our staff. So, Jen Law, if you would answer this one, what is Vail Health doing to support staff well-being and being a choice employer?
Thank you so much for this question. Hi, I'm Jen Law. I am the Chief Human Resources Office here at Vail Health, and I actually have the honor of being a part of our Wellbeing Steering Committee. We've had a very dedicated group of employees who've actually been leading the charge around well-being here at Vail Health for actually many years prior to even me getting here. And we've just been able to continue to support that. We really try to look at well-being from a variety of different angles. Maybe you think of it normally as like emotional well-being or physical well-being. We also try to support employees with financial well-being and other areas that we know people need support. We have specific programs around nutrition. We opened employee gyms on site at several of our locations. Last year, we kind of had them, but they weren't always available. And so we made sure that they were always available. To employees, we offered this amazing well-being credit of $1,000, which many people use for their ski pass. But for those who don't ski, use it for many other items as well. And then we also created an amazing well-being toolkit that really encompasses everything that we do. And when we compiled that and we share it with new employees, everyone just really has an opportunity to pick out what's most important for them and their well-being. So great question. And if anybody does want a copy of that well-being toolkit, we're always happy to share it. It might be inspiration for you and your organization as well.
Just a quick comment. Sorry
Go ahead,
about
Will.
that. Pardon me, Sally. Just want to say thank you to Jen. I could talk to you about every single one of the members of my team, but when we talk about employee engagement, we talk about some of the things that have been done, not just to support well-being, as you heard Jen say, but in general, in trying to retain and recruit staff. Jen has been such an amazing addition to Vail Health. So Jen, many thanks to you and the HR team. And I know you'll give credit right back to the operators and everybody else, but thank you so much for all that you are doing for Vail Health as well. And I'm sorry to have interrupted you there, Sally.
No, that's great. In the meantime, another question came in for Jen, which is, does Vail Health work with Colorado Mountain College on any programs for in-demand roles?
Awesome question. And I think I saw that Mark and maybe a few other people from CMC might be on the call. They're tremendous partners to us. We are so, so fortunate. We work very closely with Colorado Mountain College on a variety of roles. Clinical nurse assistants, medical assistants, radiology, just to name a few. They have an incredible simulation lab over in Breckenridge, in particular for their nursing program. Sarah Dimbeck, who's our Associate Chief Nursing Officer, spoke at their graduation last year. So we just can't say enough about how we partner, and they're always open to new ideas. And recently we've been talking to them about how they help us to upskill our staff as well, and also support our Spanish-speaking staff. That's another area that they've partnered with us. So we're very fortunate to partner with them in all areas.
Great, thank you. We did receive a question in advance that would be great for David Kaplan from Colorado Mountain Medical to answer. And it says, is there a general reevaluation for our community's needs in the area of endocrinology?
Yes, thank you, Sally. I think the quick answer is yes. We're always evaluating what are the right specialties that we need to have, what is the right partnerships, not to kind of beat a dead horse that Will was alluding to, but looking at our regional partnerships and seeing, how do we provide endocrinology services, not only for Eagle County, Summit County, but our neighboring counties as well. We're very fortunate that we have endocrinology here. We're actually one of the only health systems within our mountain communities that have kind of a full-fledged endocrinology practice. And so, yes, I think the quick answer is we are always evaluating, actually on a weekly basis, what are the right services, what is the right model, how is it sustainable, how do we provide the right quality, service, and access. So.
Terrific, thank you. Another question that came in for you, Will, would be, can you talk about how changes at the federal level with Medicaid and Medicaid disenrollment might impact our community and the collaboration with Mountain Family?
You bet. Happy to talk about that. And again, David, thank you so much. I wish I could spend more time talking about the impact that he's had at Colorado Mountain Medical. And I'm so grateful to the entire team at Colorado Mountain Medical that has really increased the number of primary care physicians, specialty physicians, again, as part of our accessibility pillar. So thank you, David and team. Coming back to Medicaid disenrollment, we have a great relationship with Kim Bimsteffer and the Department of Medicaid. It's really called something different, but you'll understand it better if I say Medicaid. And the reality is there was a lot of people that were enrolled in Medicaid during COVID who didn't have to renew during those years of the crisis, which means the Medicaid ranks got bigger. And then as that public emergency designation went away, that disenrollment process that was temporarily frozen was reinstituted. It's been going on for years. This is not something new. And it's just a matter of making sure that people are coming back in and ensuring that they do qualify for Medicaid. Unfortunately, a consequence of that is that we have people who previously have Medicaid who now don't and who are uninsured. And so we're trying to figure out ways that we can help them, if they qualify, get re-enrolled. And if they no longer qualify, how can we help them ensure they have access to care? And Mountain Family Health Center, if you all don't know, that's the local federally qualified healthcare center. They provide care not only in our valley, but also the Roaring Fork Valley. They're a great group of people. Dustin Moyer is their new CEO. I shouldn't say new, maybe a year now. But they've seen their uninsured ranks go up while their Medicaid ranks have gone down. And that creates a lot of financial pressure on them. So we actually just had a meeting recently with Dustin and with our colleagues from Eagle County paramedics, with our colleagues from Eagle County, Heath Harmon from a public health perspective. Chris was there, I was there, David Kaplan was there, and we were talking about how can we lean in again to take advantage of every resource that's out there, whether or not it's a federal resource through the FQHCs, a state resource through Medicaid, a local resource like Vail Health, or a resource from commercial insurance companies. How can we share in doctors and staff, and again, very limited resources, to try and ensure that that really important safety net service is here and for the long term? And again, as we're embarking on our strategic retreat this summer, and as I think the county will do its normal community health needs assessment, we all kind of pull our plans together. We hope to be talking about what I referenced earlier, which is what are some of the other vulnerable populations, including people who don't have access to health insurance and therefore then have problems accessing health care. And then also our aging population. So many people who are in the older adult population really built this valley, or have been so essential in ensuring its success. And so how do we help them figure out ways to meet their needs? And it's not just about healthcare, it's also about housing for them as well. It's also about finding places to connect and have social interactions. But it's been a challenge with Medicaid disenrollment and more people coming uninsured. But we have to work with Medicaid. We have to work with Mountain Family Health Center and our county and Vail Health to figure out how together we lean in to make it better. And that's what we'll continue to do. Thank you for that question. That's a really good one.
Great. Well, that is all the questions that are in the chat right now. So
if you don't mind, Sally, I just, as we kind of wrap up and maybe another question or two comes in, just want to ask everybody to please, if you enjoy today's session. Please come back next year, encourage others to attend. We will post this on our internet so others can see it. If you want to volunteer, if you want to talk, if you want to be involved in figuring out ways that we can continue to make this the best place to live and work and visit, don't hesitate to reach out, whether or not it's about being a part of Vail Health or some of our other nonprofit organizations. We really are all in this together, and what makes this valley special is we're incredibly diverse, but we are all connected by the same desire to do good by this community. And I'm stealing someone's quote, and I think I said it last year, but I'm going to say it again now. Diversity is our strength, and unity is our weapon. And together, we can do great things. So thank you to all who've been involved, mostly our providers and staff who take great care of our patients, our board who has the vision and is so willing to give us support, and to all of our community partners, and to all of you that are out there that are helping us ensure that we do right by our mission. So thank you so much. Be healthy, be well, be good to each other, and we look forward to seeing you at the next one. Thank you, Sally, for all your help as well. God bless everybody.